is that we have got about 20,000 oxygen cylinders that are out there in people's homes, that are in hospitals and other institutions. Now, these cylinders are required back to the industry immediately, and we are appealing to anybody who is holding oxygen cylinders to immediately return them so that the companies can be able to use them to supply oxygen to our hospitals. And these cylinders are expensive. The international market is obviously very squeezed now, and supply is a problem. Each cylinder costs about 40,000 shillings, and therefore you can do the maths. The cylinders out there, to replace them would require a substantial amount of money. So we are requesting and we are asking for assistance, even from the government, GAO, to at least identify. And by the way, it is an offense to keep the cylinders when we have asked for them under the Public Health Act, that please return these cylinders. They are a matter of life and death at the moment. And facilities, there are a lot of facilities with these idle cylinders, and I don't think people are appreciating just how important it is not to have cylinders lying around when people are dying because of lack of oxygen. The second thing that we also came to realize is that we need to increase the infrastructure for piping in hospitals. What is now happening is that in a lot of facilities, individual cylinders are being used per patient, so that you have got an oxygen cylinder sitting next to a patient. Now, this is inefficient and dangerous. It is inefficient because one cylinder can be used by quite a number of people if the oxygen has been piped to the bedsides. So we are asking our facilities, both county facilities as well as national government facilities, to fast-track the piping of oxygen to bed outlets so that we can be able to use some of those cylinders for industry, and we can also begin to fill some of them. The second thing about the danger is, of course, this is the pressure. Cylinders, they are pressurized, and anything can happen when you have got something like that sitting next to a patient. We are also asking our doctors, the ones handling our hospitals, heading hospitals, to quickly work on repairs of the concentrators. There is about 20,000 of them around also, so that they can be used both for home-based care as well as the hospitals. We have around 70 plants, oxygen plants in Kenya. Most of these plants are in disrepair, and we need them to get working. We need to repair them very urgently, and going forward, there are a couple of things that we have appreciated, realized, that we are going to standardize the kind of oxygen plants that we have in the country. This is because, as we speak, we can't get spare parts for some of the plants that were built a couple of years ago, essentially because they came from sources that are suspect. And if I give an example, the oxygen plant in Kenya National Hospital was, for example, supplied by the then Czechoslovakian Republic. The country itself does not even exist. So how can they even begin to repair the Kenyatta National Hospital plant? We need to standardize from what is the supply capacity of those oxygen plants. So let's not just say we are getting an oxygen plant without real standardization. The Ministry of Health, working with county governments, is going to ensure that this standardization has been spelled out very clearly going forward. We have also appreciated that it is not just enough that we produce oxygen. The purity and quality of oxygen is also very important, and the industry is taking certain measures to ensure that the quality of oxygen that we get is what is required. In addition to that, we also be appealing, working with the Treasury at this particular moment, because of the nature and emergency nature of the requirement for oxygen. We are going to work with the Treasury to see whether we can be able to increase the oxygen cylinder supply via reduction of some of the taxes. But this is a discussion that we need to get together with the industry. We are also, as a ministry, going to work through the PPB to make sure the certification of gas suppliers is fast-tracked, even within keeping in mind the quality, the ability of those suppliers. But nonetheless, PPB has been requested to try and fast-track any certification necessary to gas supply companies so that we can increase our capacity. In addition to standardization of the plants, the ministry is also looking at the possibilities of creating a policy where we are more at home with the lease of plants, of oxygen plants, rather than the purchase of oxygen plants. We have all seen the challenges of maintenance, the requirements in terms of qualification of people who maintain these plants. There are so many issues involved, the process of purity of the oxygen, and therefore we are keener to look at the policy of lease rather than purchase of oxygen plants. So, ladies and gentlemen, I just want to once again thank those of you who are in the industry. I'm going to ask Marion from BOC to give you a little bit more about this issue of oxygen, and also introduce some of the colleagues she has got as representatives of this industry. Marion, please.
Thank you, Waziri. And Madam PS, it was a very good meeting today, and we really appreciate being involved in this combined effort that the government is having towards this situation that we are in as a country. It is a crisis. We agree it's a crisis, and we need all the help we can get from patients, from hospitals, and from other decision makers that are holding tanks and are holding decisions around oxygen supply. Before I introduce the industry participants who came here today, I just want to re-emphasize on the 2 points that the Waziri has explained now. If you're holding cylinders at home or in the hospital for non-COVID or non-emergency care, please return them to us. We've lost many cylinders in the last few months. Any cylinder you have in your hands can save somebody's life. And if it is not in use, it is actually being missed out in another hospital. I want to just thank everybody for those who have been very patient with us during this time. We are now supplying oxygen on a day-to-day basis, rationing what we have, so that every hospital can find. And also for the industrial customers who continue to understand that we are focusing on medical cylinders and not industrial, because this is a situation that we all have to come together. We're very keen, Waziri, to work with the ministry going forward to give you the information on what we can do and what additional resources or support systems that we need. And we already appreciate the support that you gave us this morning. So as BOC Gases, I'm here with John Kamau, our healthcare engineer. Thank you, John, very much for especially working very hard to put in piping in the hospitals, which was actually the second big priority to pipe the hospitals. I'm here with Raj from Gas Africa. And we've got Synergy Jaspal from Synergy Gases on that side. Thank you very much, everybody, and thank you, Waziri, for this opportunity.
Okay, thank you very much. Raj, you want to say anything?
Yep, thank you very much, the CS, for the audience this morning, and PS and the Ministry for supporting all our gas manufacturers, packers, distributors within Kenya. Obviously, being competitors, we have to take the decision what is right. Life will always come first. It is right that we come together, find the solutions, whether it's PSA plants, erection, installation, commissioning. Gas Africa are here obviously to promote that into the hospitals. John, BOC is obviously fronting that also, as our friends now at Synergy Gas. Just to echo Marion and CS, any cylinders that you're holding in excess or by bedsides or in homes, or you find belonging to any of our companies or any indeed of those manufacturers that couldn't be present today, if they could be brought back or notify those manufacturers, they can be recalled. We're making all efforts to the healthcare industry. We've also sent out circulars to industries to say that we will only be filling medical cylinders in the foreseeable future. We are here to serve the people of Kenya. We appreciate your patience. We are delivering through the night. We are running day shift, night shift, 24/7. We are open to collections. Kindly bear with us. We know your orders have increased 5-6-fold in some cases. We are trying to serve all of our customers. We're not taking on any new customers. We're splitting all the production capacity that we have. So we would like you just to bear with us, as we are also investing in capacity in cylinders, in plants, trying to come to SLAs with other companies to pack for us. We are here to serve you. We would appreciate your ongoing understanding, and thank you once again to the Ministry, CS and PS for their audience this morning, and Marion and the team at BOC. Thank you very much.
Asante sana. Falgun, you have anything to add? No? Okay. As I said today, this particular session was essentially to brief you on oxygen and to bring to light to Kenyans just how important this particular issue is. What we are talking about, fellow Kenyans, is actually air. It's the same as you are breathing right now. It is exactly the same situation if somebody is unwell and they do not have gas, this oxygen. It is the same as you holding your nose and not breathing. That's what it means. So if you can appreciate that, you just hold your breath and that's permanent, then you can appreciate why it is so important and why we are here this morning. And I particularly want to appeal to the media in this country, social media. I want to appeal to you, members of the Fourth Estate, to please make this a priority in terms of communication, in terms of appeals to the people who might have these cylinders, to please bring them back. We need them as a matter of urgency, so that we can be able to continue saving lives. Other than that, the rest of the briefing will come through the normal channels at a later time. Thank you all very much. Any questions? I think the only thing to add is the issue of the actual demand in the industry and what has transpired over the last couple of months. Last year, the total production and requirement for the industry was about 410 tons. That quickly went up around January to about 560 tons. We are now heading for a demand of double what we started at 410 at 880 tons. So where the situation at the moment is such that the industry is completely stretched. And if we go any further than that, then some immediate steps will have to be taken. I also want to take this opportunity to also thank the industry that normally uses the oxygen or supply from the companies that are here today, particularly the horticultural industry, the food industries, that use a lot of, that use supplies from these companies, because some of them have stopped the industrial production so that they can concentrate on health. This is going to inconvenience the industry a lot, but we beg for their understanding. At the moment, the idea is to save lives first, and then we can deal with other things later. Asanteni. Thank you all very, very much indeed.
Good afternoon. My name is Mutanu Banadin. I am a reporter with the Daily Nation. I have two questions. One is unrelated, but one is related. You've spoken about piping of oxygen in hospitals. So far, how many hospitals have piped oxygen in the country? And the second question is about a vaccine. I've seen a research which states that women are coping well pregnant women are coping well with the vaccines. So I don't know whether you have received that research. And if you have, is it going to maybe make you to review whatever guidelines you had before on those who are to be vaccinated? Thank you.
Okay, thank you.
Raquel Muigai, Citizen TV. What is the plan by the ministry in terms of vaccines? Will we receive the batch that we had expected in April, given that India had now put a suspension, temporarily hold imports? Secondly, are there any plans to cushion Kenyans against the new measures, the partial lockdown that has now seen other businesses close? And also, what is the status of the variants that are now in the country in terms of also the spread? Yes.
Thank you very much. First, Mutani, on the issue of the number of plants, we have about 75 plants in the country. But as I said, there are some of those that are not operational. So the question is to try and revive those are in operation so that by the end of the day, we have got clarity about exactly how many plants are working. Under the support of the World Bank, there are other 6 plants that we are going to quickly plant across the country in various regions in accordance with the assessment of our donors. In terms of research, the information we have right now from the World Health Organization apparently is that below 18, persons of below 18 and pregnant ladies we are not vaccinating in this country. But of course, we are also following trends elsewhere and information that come from the experts. So if the experts come and say that that is the position, then we will go with that position. Muigai, on the issue of the April arrival, we believe we are still pushing and we are working with India on this particular issue. We have got our diplomatic, we have rolled out our diplomatic assets to ensure that we get the vaccines when we are supposed to. And I think it is important for us to appreciate that it is not a Kenya situation. In this particular instance, is actually an Africa-wide situation. By now, under the COVAX facility, we are supposed to have received 40 million doses for the African continent. Currently, we have just received 12 million doses. So you can see the gap that is there. And our appeal, not just to India, but to other countries, is that we reduce vaccine nationalism so that there is fair and transparent distribution of vaccines. So we are working on this. We are working with the Ministry of Foreign Affairs in Kenya, working with the Indian embassy here in Nairobi to ensure that we get what has been promised. Because on the basis of the promises, we make certain plans. We start vaccinating on that basis. And therefore, we would like to believe that the suppliers are going to live up to the expectations and to their promises. On the issue of the partial lockdowns and what we are going to do, of course, we always meet up. You remember the last time, that is exactly what happened. We meet up as a government, as a non-agency approach or ministry's approach to discuss and find out what is it we can be able to do to ease the very, very expensive. It's very expensive for people, particularly in the business sector, to see what we can do. But I cannot give you a specific answer to that right now. The variants, as I said, and as we reported last week, essentially what we have here is a continuing variant that we had all the way from last year. However, there has been detected some other variants. For example, the British variant, as well as the South African variant towards us, particularly to the south with the border with Tanzania. But so far, the dominant variant that we have is still the same one that we have always had. Thank you very much indeed.